I call Fusobacterium nucleatum the mother-in-law bacteria. And you can see the analogy. If you go in and you're like, "How can I help? I'm not gonna stay very long. I'm not gonna give you any unsolicited advice. I'm not gonna ask you any questions about why are you doing this," then you're a good bacteria. You're the beneficial side of Fuso. But it's when you go in, you become Fusobacterium Laurie, when you go and you say, "I have a better idea. Oh, and I'm gonna spend the night, I didn't tell you," and moves their stuff around, or what saying, too long, that overbearing mother-in-law. So, it is exactly what Fusobacterium is. It's good until it's too much. Yeah, and it travels to the gut.
Welcome to Take Back My Brain with Laurie Hammer, where real healing starts in the brain. I'm Laurie, a functional nutritionist and mom who's walked the path from anxiety and burnout to clarity and calm. Each week, we're going to dive into brain-based tools like amino acid therapy, gut health, fasting, and faith to help you reclaim your energy, emotions, and sense of self. Hello and welcome back to Take Back My Brain. I'm your host, Laurie Hammer, and I am very excited to introduce you to my new friend, Debbie Ozment. She is an amazing woman, and you're going to want to stay till the end of this interview. Okay, so don't cut out. Debbie is a dentist, but she's going to tell her whole story. But she has also become a whole body. What do I want to say, Debbie? She's into nutritional medicine and metabolic health, and she is nationally board certified health and wellness coach. She is the host of the amazing podcast, which I was just on, just so make sure you go check that out, Vitality Made Simple. And she's totally committed to the intervention of periodontal disease because that is her dentistry background. So I can't wait to dive into this conversation today, Debbie. Welcome.
Thank you, Laurie. It's a joy to be here.
So I have to ask, how does a dentist go from root canals, periodontal disease into metabolic health?
Well, really based on what I started seeing in my practice. I've been a dentist for over 40 years. And, back in the 80s, we thought the mouth was just this isolated, orifice.
Right.
My TED Talk's the forgotten orifice because it really is. And I say, oh, I'm talking about the mouth. It's just, it's just the mouth. It's just all about teeth. It's all about
Yep.
a smile or potentially a toothache. Our daughter, when she was 6 years old in kindergarten, someone asked her, "What does your mama do?" And she said, "My mama is a laundry lady, and she fixes teeth." And that's
That's so cute.
exactly accurate in that order, Laurie. And
Uh-huh.
so, we were very much trained as carpenters, especially in the early 80s, and still dentists are trained as carpenters. We can fix teeny tiny things on moving people in a wet environment and have have that construction hold up for years and years and years. But I started seeing people's med lists getting longer. I started
Mhm.
seeing, anxiety increase, which is why I was interested in talking to you. I want your listeners to
Yeah.
hear your excellent podcast with me. It's going to help so many people. I started seeing people collect doctors. So they started getting more and more physicians, and they'd be looking at their schedule and say, "Well, that's my kidney doctor. Well, no, that's my cardiologist. Oh, that's my psychiatrist. Oh, that's my big toe doctor. Oh, that's my," and it's just like something's not right.
Mhm. Right.
People are getting sicker. And so a turning point, Laurie, was a patient that was very committed to her oral health. She came in every 3 months. She sat in the same chair. She was very regimented, a major person in Oklahoma City. She always did what she was supposed to do. So she comes in. She always looked inflamed. She never looked healthy,
Mhm.
despite excellent home care. And
Uh-huh.
so she comes in and she looks really healthy. And I said, "What are you doing differently?" She said, "Nothing. I am doing what you told me." And I said, "I know you always do what I tell you." And I said, "There's something different. You're healthy." And she said, "No, I'm nothing different." So I said, "You're going to think of it. And when you do, please come back and tell me, or please call me." So she left. She went to her car. We could see her come back. I said, "She thought of it." Sure enough, she comes in, Laurie, and she says, "I'm getting a vitamin D injection once a week." Now, this was at about the year 1999. I mean, this is long.
Okay.
And so vitamin D wasn't in the news. And she said, "Do you think that could make any difference?" And I said, "Well, I'm gonna figure it out. I think it has. I think that's the only change." So sure enough, that started my snowball of research and
Yeah.
curiosity. And so now we know, of course, vitamin D is a hormone, and it makes a difference in every single cell in the body. So next, I went to a vascular inflammation class given by some cardiologists back in the 80s. In the early 80s, when I was in dental school, there was starting to be murmurings of, oh, maybe these oral bacteria affect
Mhm.
heart, and it's logical.
Yeah.
It's an inflammatory gum disease is an inflammatory problem, but literally, when I was in dental school, probably a junior in dental school, I literally got yanked by the hair into the consultation room because
Really?
I told somebody that if they would take better care of their gums, maybe their blood pressure would improve. And it was
Yeah.
like, "Oh, we can't say that. No, no, you're making a false claim." But it was logical to me,
Right.
and it is true now. So that first big class I took was heart attack and stroke prevention. It now has
Oh,
become
wow. Mhm.
well-done preceptorship. It's really awesome. At that course, salivary diagnostics was launched. So that's a saliva test that we can actually, a simple saliva test. People can swish and spit, and we can see the parameters of 11 different key oral pathogens. So
Wow.
bad bacteria in the mouth. We can see their levels. It's based on the DNA of these bacteria. So now that was in. I guess that test first came out in 2010,
Yeah.
but these bacteria now we know, the DNA is found in the brain, it's found in the blood-brain barrier, it's found in, swollen joints. It very much impacts anxiety. Pathogens very much impact
Right.
anxiety because they're so pro-inflammatory. They trigger interleukin-6, TNF-alpha, all of the things that cause inflammation. So that sort of started my journey, and now my practice is actually limited. I don't fix teeth anymore, Laurie. I haven't picked up a handpiece in a long time, but I do help people with their periodontal health. You know that, um, it's a common saying for all the listeners that health starts in the gut, but now we know that the gut starts in the mouth. So
Yeah.
these oral bacteria don't stay in the mouth, and actually the teeth are the last to go. So they're going to
Right.
affect other parts of the body long before they harm the teeth.
Yeah, and I've heard that your teeth are a sign of like if you have soft teeth, they're ground down real easy, like that's a sign that you have soft bones. Is that true?
Yes, I mean osteoporosis can show up in the mouth, even in the supporting structures of the teeth, the bone around the teeth.
Mhm.
Also, it's interesting. This is really something I've just learned lately, in the last few years, but a lot of grinding is oxygen hunger. So
Mm,
that is based on, airway. So a lot of people actually have a small airway because of all the soft food that we've
right.
eaten, little kids have eaten. It's not chewing on things like they used to. Also,
Yeah.
we get wisdom teeth taken out just, as a matter of routine. I mean,
Mhm.
all the people I've had, get there. We didn't know, and it's still happening, but now I see it so differently now. I mean, God put those wisdom teeth there to help hold the airway open.
Yeah,
Everything's there for a reason.
everything is there for a reason. Well, and I know I had cavitations where my wisdom teeth were, and I had to have them fixed twice, Debbie.
Oh my
It
goodness.
was it was awful, but the second time I had it done, the biological dentist who did it, he tested the stuff that was in. So he tested the bacteria and the stuff that was in those cavitations. I'm like, no wonder I couldn't get well.
Oh, Laurie, I
No
applaud
wonder.
you, a biological dentist.
Oh yes.
It's
Yes. And
so
I teach that to all my clients. Like you have to and like everybody has to get their mouth x-rayed. Everybody has to, we got to know what's going on in there. Do you have a root canal that's a hidden infection? Like, because I look at their blood work, their lymphocytes or the neutrophils are high. Their doc is like, it's fine. It's a normal range. Well, no, your cortisol is jacked up. Well, why is your cortisol jacked up? You've got a hidden infection because everything else has been covered. So where's that infection? And it's usually here.
You're right. It usually is here, and it can be so shocking. Back in 2013, a physician, so now my patients are a physician referrals. A physician sends a patient and says, "Debbie, I think this woman has cancer. I've checked everything. Her C-reactive protein, which for our listeners is a measure of inflammation, it's very nonspecific. We don't know where it is with C-reactive protein, but it also is a risk factor for heart attack and stroke.
Hmm.
And her C-reactive protein was 18.1.
Oh,
And
wow.
yeah, and everything else was coming back, within normal range. So she's like, see what you find. And if you don't find anything, I'm sending her for an MRI, a PET scan, just all these things.
Yeah.
And so we did an oral DNA test. She had high Fusobacterium nucleatum, which I'll talk more about that later, but that's a very sneaky bacteria. She also had one of the what are called red complex bacteria that can be very pro-inflammatory. So bottom line, Lori, I did a deep scallion root planing. I use a laser. In those days I wasn't using ozone. Now I'm using ozone, but nevertheless, it was very simple, no antibiotics. And I use antibiotics sometimes, but not on.
Hmm.
She happened to be getting another blood test 60 days after her periodontal treatment, which is
Yeah.
really pretty close. Her CRP dropped from 18.1 to 2.9.
Wow.
Only change. And so actually we see better results farther out. We
Right.
see better, once our bodies are designed to heal, and once that healing starts, it frees up resources in the immune system to go other places.
Right.
And so we actually see even better results down the line. But that was just such an aha moment for us here uh, to realize how big a simple therapy, a really
Right.
inexpensive therapy is.
Yeah.
And that's easily overlooked because bleeding gums, like anxiety, like anxiety is normal.
Hmm.
Uh, talked about that in your interview.
Yeah.
It's so normal that it just gets ignored until it's really bad. But bleeding gums are the same. If someone is not really trying hard to keep their oral microbiome healthy, they're going to have bleeding gums, and it just gets ignored. Doctor, it's like, oh, you look fine, a little bit of bleeding, no problem. See you in 6 months, and and down the line, it's not really worried about it until it's gum surgery. But
Right.
at that point, it's already impacted the gut. It's already impacted memory. It's already impacted arthritic problems. It's already, it's in fact impacted all the neurotransmitters that you're working
Hmm.
in the absorption of these nutrients that you're working
Yep.
with. And it's so big and it's so simple at the beginning.
Your brain runs the show, so don't let toxins run it ragged. God designed our bodies to heal when we remove the interference, and Zeo Charge from Zeolite Labs helps me do just that. This detox magnet targets heavy metals, mold, and other toxins while sparing your essential minerals. It is clean, third party tested, and so easy to use. So I want you to take back your brain today with Zeo Charge. Get it now at zeolitelabs.com. That is Zeolite labs.com. Yeah, it's so true. When you're talking about bleeding gums and, keeping the airway open, there's just so many factors there. And it can feel like overwhelming. And people are like, I just don't want to address it. I don't want to spend the money for that, blah, blah, this and that. So I find it hard to get people to address what's going on in their mouth. They're like, "Well, I was sick before this happened." I'm like, "Yeah, but you're not going to get well unless you address what's going on in your mouth, right?" So I find it hard to get people to go through with some of those things sometime, but eventually they do. Quick question and this is for me. Um, if I might ask a question.
Sure.
Yeah. So crazy thing. And I've never had a dentist been able to like give me a good answer on it. They're like, oh, just keep doing it and it'll go away. And so even ever since I was little, Debbie, and I mean like probably 10, 12, I remember this happening because I've always tried to floss my teeth. But if I floss my teeth like more than a day in a row, I get a migraine. Does that make sense to you?
Oh,
Yeah. And every time I go have my teeth cleaned, which is I only do it once a year. I know you're supposed to do it like, twice a year or more, but I get I get headaches for like days after. And sometimes I'll get a migraine that night. Nobody's been able to tell me why. And my gums aren't bad. I mean, they'll bleed around my period, so I know that's like hormone related, and then they'll stop. But my diet is good, like you know what I do.
yeah.
So
I know.
Um, I've never been able to figure it out, so I honestly don't floss very often, which I know I need to, but if I do it too many times in a row, I'll get a migraine.
I would suggest something different. Let me look around here. Okay, this is what I would recommend.
'Kay.
These these little brush picks.
Yep, I've used those. Yep.
Now, with these brush picks, let's see if I have one sitting here. The thing is, you it's not just like this.
Okay.
You actually get in there and scrub.
Oh, okay.
Like, I'm pushing hard against this tooth,
Uh-huh.
and then I'm gonna push hard against this tooth,
Oh, cute.
and
Oh,
I'm way up under the gums. I mean, like,
okay.
you
I'll
might
try that.
you can hear it squeak, but I'm way up under the gums. Now, it makes me wonder, Lori, if, like, that's releasing bacteria that I mean, periodontal disease is related, even early periodontal disease. When we say periodontal disease, I say people think of Billy Bob teeth, these
Yeah. Yeah.
they think it's really bad, but it can be something really small, and when you were 10 years old, 12 years old, you had quite a few permanent teeth. You probably didn't have if you had baby teeth, you had just maybe 4, not that many.
Yeah.
But another thing people can do, and I mean, this is because I'm at my desk area, and this is what I use. I bottle up black seed oil, Nigella sativa, for my patients. This is a naturally anti-inflammatory oil, black seed oil,
Mhm.
Nigella sativa, and it has an active ingredient called thymoquinone, and thymoquinone has been heavily studied globally for so many things. I discovered it about 2 years ago and did 3 podcast solo episodes on it because it was so fascinating. It's good for you can take it internally. It's good for blood sugar, but it's also just good in the mouth. So I did my own experiment. I,
Yeah.
uh, I didn't get my teeth cleaned, and when I was supposed to, I got my Fusobacterium, which is this bacteria I want to tell you about, but it's a very common bacteria that has a lot of systemic implications.
Okay.
I didn't get it tested. I didn't get my teeth cleaned, but I got it tested, found out where it was. I used black seed oil with oil pulling,
Oh, yeah, yeah, yeah. Mhm.
with a little bit of coconut oil, a little bit of black seed oil, swished for at least 10 minutes, 10 to 11,
Mhm.
most I can stand it, for 30 days, got retested, and my Fusobacterium came down 30% in 30 days.
Interesting.
Yeah, really huge for systemic health.
Yeah.
Now, and mine wasn't high, but it still came down. Fusobacterium is an interesting little bug. It's called a commensal. So at low levels, it's actually a beneficial bacteria.
Mhm.
When when it overgrows and starts building, it's a bridge builder with bad bacteria, causing problems that it's really, detrimental. I call Fusobacterium nucleatum the mother-in-law bacteria. And you can see the analogy. You know, if you if you go in and you're like, "How can I help? I'm not gonna stay very long. I'm not gonna give you any unsolicited advice. I'm not gonna ask you any questions about why are you doing this?" You know, then you're a good bacteria. You're the beneficial side of, Fuso. But it's when you go in, you become Fusobacterium Laurie, when you go and you say, "Oh, why is this in the why, why are oh, I have a better idea. Oh, and I'm gonna spend the night, I didn't tell you." And, move their stuff around or what, you know what I'm saying?
Alright.
Spend
Mhm.
too long, that overbearing mother-in-law. So, it's really, it is exactly what Fusobacterium is. It's good until it's too
Yeah.
much.
Mhm.
Yeah, and it travels to the gut. So one of the like, when a patient sees me, I do, 3D cone beam, which you mentioned, you've gotta
Yep.
have that, find those places like cavitations. I do a saliva test, and I do a stool test. I use the GI map, and because the GI map shows Fusobacterium in the gut,
Mhm.
Fusobacterium stimulates autoimmunity. It actually is, by a lot of research, is causal for colorectal cancer. I mean, I say
Oh.
fully in full
Yeah.
disclosure that that is a big word, but, after I did my TED Talk, I had a lot of researchers writing to me and saying, it's causal, you just said it's correlated, but it's causal." And not in every case of colorectal cancer, but also it's correlated with, breast cancer. I mean,
Okay.
it is so big, and I see it so
Interesting.
consistently, Lori, because these patients I'm seeing a lot of sick patients, their
Yeah.
referrals, and usually their Fusobacterium's high. When we lower their Fusobacterium, their inflammatory index goes down, typically their autoimmunity gets better, lots of things get better.
Yeah.
Fusobacterium, interestingly, if anybody out there is dealing with colorectal cancer, it this oral bacteria that starts in the mouth, travels to the gut, can render colorectal cancer cells immune resistant to 5-fluorouracil, cisplatin, oxalic,
Wow.
those 3 types of chemotherapy that are commonly used for colorectal cancer are ineffective if Fusobacterium is high in the gut. So,
Wow.
get rid of it in the mouth, and a lot of times have to use the antibiotic in the gut, chemotherapy starts working.
Wow.
Amazing.
It is amazing. Wow.
Mhm.
Okay. Good to know. I will try that. Thank you.
Yeah, try that. Oh, and I have an online free class. It's
Yeah?
called Upstream Gut Health. Yeah, it's Upstream Gut Health, and it'll be free for another couple of months at least.
Okay. I'll put that in the show notes.
Yeah, yeah. I mean, have people, access it because I talk a lot about, this and show techniques because you don't have to do oil pulling. I actually oil pulling sounds good, and it is good. It's just hard to be consistent with it for most
Yeah,
people.
and you have to be in the sometimes you just have to be in the mood to do it. You're like, not today."
Not today.
Or like, "Maybe I could do it in the afternoon, but I can't do it in the morning."
True, Lori,
Yeah,
not today.
"Not
Well,
today."
isn't that, they say do it for 20 minutes. Oh, my 11 is my
Yeah. Well,
record.
when I do it, when it is the day that I will do it, I'll do it and I'll walk while I do it. Like I'm walking my dogs. Because if I do it around the house, I'm like I kinda tend to, like, gag if I'm doing something, so
Then you're spitting in the neighbors.
and when I'm
His
yeah,
neighbors
I
going,
am, like, picking
"There's
up
that
dog food, spitting next right
yeah,
now.
that doctor out there spitting in my yard."
"What is she doing?"
Yeah.
All my old neighbors are like,
Oh, yeah. No, it's ancient mouth cleaning, but,
Yeah,
there's other ways. There's other ways to get Nigella sativa, black seed oil, in your mouth and get the benefits.
I will do that, Debbie. Thank you. Thank you very much, and I will report to you and let you know.
Let me know, yeah.
Well, that'll be great. I had somebody tell me it's probably like an emotional trigger from a trauma childhood, when you were like 10 or 12. I'm like, yeah, I don't know. I feel like I don't feel like I had anything associated with my mouth, but
It
whatever.
might just be gross, you
It might
know?
just be gross. It might just be a bacteria that's just been there and hasn't gone away. I don't know.
Yeah, yeah.
Yeah.
So
Anyway, craziness. So I was watching one of your videos on Instagram and you carry sardines in your purse. And I was laughing because, like, when I travel, I too will carry, cans of fish in my purse along with like olives and tomatoes. And I'm assuming, like me, that you didn't always do that.
Yes,
Right. And so
yes.
this has been a progression for you as you have learned, about metabolic health and inflammation and seeing the changes in your oral health. Like
Mm.
some people are like, oh, that's just really